Heart patient says a big thank you to a team that helped save his life. Joining us now with his story of gratitude is medical reporter Liz Bonus. Hey, Liz.
Hey, Kyle. Good evening. Good evening to you. A local man says he could barely take a few steps without losing his breath before a complex procedure that saved his life. We stopped by the Christ Hospital Heart and Vascular Center to meet him and be there when he came back to thank some of the team that gave him a second chance.
It's good to see you, my man.
By the time Ron Culyer connected with Dr. Robert Riley here at the Christ Hospital, he'd already had heart bypass surgery and a heart attack following it.
It was out of the blue. I was working, making some phone calls, and next thing you know, I'm, short of breath. The chest is tightening. I break out into a sweat.
It turned out what they had bypassed in the original surgery had blocked off.
What he had is a chronic total occlusion. Chronic just meaning it's been going on for a while. Total meaning 100% blockage, and then occlusion obviously meaning blockage there.
The solution? Opening up the original native heart artery that was bypassed in the previous surgery.
When we look at the data and we look at opening up bypass grafts, the likelihood of those staying open long term is unfortunately only around 30 to 40%. Whereas we look at opening up the artery that you were born with, those patency rates are upwards of 90% over a 5 or 10 year period.
To do that, Dr. Riley's team, one of the few in the country able to perform a complex CTO procedure.
The blockage was really, really hard to actually kind of get through. So we actually went around it. In the wall of the vessel itself, we traveled around the blockage, and then once we got past the blockage into a vessel that wasn't blocked, we actually used a special balloon that allows us to stick very stiff wires back into the vessel itself.
As this graphic, courtesy of Boston Scientific, shows, they can then use a specialized balloon to crush what's blocking the blood flow and open it up.
As soon as I woke up and started coming to, I could tell just my breathing alone was a lot easier.
Within days, Ron Culyer told me he realized how quickly his life could have ended.
That's why I'm filled with gratitude, because without Dr. Riley and his team, I may not be standing here today.
Lucky us. Ron was grateful that they saved his life, but they also helped when his insurance company, believe it or not, initially refused to pay for this procedure, saying it wasn't medically necessary.